Hi, welcome back. This is your medkey QuickStart video. Now, the idea of this video is to help you get the device onto your horse straight out of the box. So we're going to go through a few very simple programs that you can use on your horse and take you through a little bit of the settings in the back end of the device so you can use the device to the best of your ability straight out of the box. Now, there is a lot in this device, and that's why this video is just to show you a few things to get you started. So the most important thing is how to boot the device up. Now, just before I do that, note that I've just got it resting in the charging station just for the video. Just a bit of advice, don't leave the device charging for days on end. Once the device is charged, lift it out of the charging cradle and put it to the side or use it. All right, so how do we boot the device up? So this is your home button. That's the only physical button on the device. We use it to turn the device on, we use it to turn the device off, and we use it to back out of the menus to get back to our home screen. So let's do that. Let's turn the device on, and immediately the device boots up. So you've got in front of you three words: keyphoresis, bioregulation, and diagnostic. Bioregulation is the one you are going to use most of the time. So a few little things about the device. Up the top is your battery level. The battery level is about 60%, the blue, and then it goes down that way to the left, and what will happen is the device will give you audible tones and it'll have a red line there saying you're about to run out of battery. Now, you will have plenty of battery to treat horses all day because the battery is a big battery and you'll be fine with that. So before I do that, you can see here the screen is black. So you can change the screen. So if you're outside, you go into your settings and you go to your color scheme. So we can choose white or black. If I choose white and back out to the main menu, you'll see that's a lot easier to see. So you can choose which color you want. But for the moment, I'm going to go into black for the sake of this video. So once again, bioregulation is the one we're going to use. So to enter that, we go straight in. Now, there's three programs you're going to use. In all the programs, I suggest you use Impulse Energy 10. You can play with it after that, but always start low. You can increase as your horse becomes accustomed to it. Now, once you've chosen that, we can lock the device. Don't worry about these. We'll talk about them in another video. But to lock the device, we press that bottom and we slide to the left. Now, a little bit of pressure and slide to the left. I'll do that again. To unlock, I'd simply press the home button. So I'm going to slide to the left. So the device is locked, so I don't have any problem accidentally ramping the energy up while I'm using it. Now, let's look at the three settings that I suggest you begin with. They are sedation, and the entire words of these programs are the effect that it does on the horse. So you're talking about sedating pain, sedating swelling, sedating inflammation, and sedating that high sympathetic tone of a horse. And that's why in subsequent videos, you're going to see me talking about use sedation in the 7 steps. So what you're doing is you're calming the horse, putting it into that relaxed parasympathetic state so you can begin treatment on the problems that you find. Another setting to use is relaxation. Relaxation, really good for muscles. Muscle tightness, muscle pain, muscle strains, very good. So remember, you lock and then you go to work. Remember, you're either using, in this case, the hair electrode, your long-handled comb, or the matrix electrode, which is for shorter haired horses if you want to treat large muscle groups. And we saw that in your unboxing video. So we've talked about sedation and relaxation, and the final one I want to talk about is trigger. And that's up here, trigger, and I'm going to lock that. Now, trigger's a good thing to finish with on your treatment because it's a very low pulsing frequency, which will relax the muscles, will relax the horse very quickly. All right, so three programs: sedation, relaxation, and trigger. And that's all you need to start with, because the skill is using the device on your horse. We can go through all the different settings later, which there are going to be videos, as I said. But at the moment, 3 programs to begin with: sedation, do your 7 steps; relaxation, clear those points, release those muscles, and finish off with trigger. If you have a very sensitive horse, you can always go into your settings menu and you can go into what we call low mode, where you can reduce the impulse by 50%, by 40%, by 30%, or down to 10%. So low mode 10% is 10% of the level that you have. So if you have the energy on 1, it's 0.1% of 1. So if you have a very sensitive horse, that's a good thing to do. So I'm just going to make sure I'm going to put it back into normal mode and go back into my main menu, and I'm going to go back and I'm going to choose sedation, because I'm going to go out and I'm going to do my 7 steps on my horse. There we go. I'm ready to go once I put my electrode head on, and I'm off.